And welcome to Nutrition Therapy by Lucy. This is a channel where we talk about food, good nutrition, and health. Thank you for your support, for always watching my videos, leaving a comment, giving them a like. I am so grateful even for subscribing to this channel. But if you're here for the first time, please make sure hit on that subscribe button, the red button. We get to learn all together. For the new subscribers, karibu sana, feel welcomed. Here we talk all matters nutrition and health to make sure that we live or we have a healthy lifestyle. So back on cameras after 2 long weeks of not feeling well, but I thank God I feel healthy and more energetic and I'm able to do this. So today we are going to learn about gestational diabetes. We get to understand the condition, some of the symptoms, treatment, and of course we do the nutrition therapy of gestational diabetes. So relax, keep calm, grab your pen and a notebook because this is a learning lesson or a learning session as usual. When you hear of the word gestational, pregnancy comes into your mind. So basically gestational diabetes, it is a condition in which the blood sugar levels become higher during pregnancy. We have two classes of gestational diabetes. We have class 1, in which an expectant mom can be able to manage the condition with diet and exercise. But in class 2, an expectant mom manages the condition with both diet, exercise, and medication, which actually involves insulin therapy. So in class 1, you only manage the condition with exercise and diet. And in class 2, on top of the diet and exercise, you add medication or insulin therapy. But all this is dependent on the diagnosis, and the doctor will be able to guide you on which way to go for good health, for your good health, and also for the health of your baby. So when it comes to gestational diabetes and symptoms, sometimes it can present itself as type 2 diabetes with all the classical signs of diabetes type 2, which includes feeling more thirstier than normal, peeing more than usual, and also getting hungrier more than usual. But not all expectant moms experience this, but those are 3 classical signs that you can start questioning yourself. I know maybe going to the toilet or peeing is usual for expectant moms, but this comes later, or maybe in your 3rd trimester, or maybe when you are about to deliver. But when you experience you are peeing more than usual and it is your 1st trimester, getting more hungrier than normal, and also feeling more thirstier, there are signs or classical signs that you should go and have your blood sugar test taken. But it is not a worry, because actually diabetes or gestational diabetes type 2 clears away after giving birth, but it is a risk factor for developing type 2 diabetes later in life. But when you control it with medication, diet, you can be able to avoid developing type 2 diabetes later in life. So what causes gestational diabetes? It comes with hormonal changes, because actually let's go to biology bit of this. After eating any food, especially let's say maybe you are carbohydrates, because we get the blood sugar from the carbohydrates. After eating your food, the pancreas produces insulin, which actually should help the blood sugar or the glucose to get into the cells for energy production, so that you can feel energized. But in cases of pregnancy, because of the hormonal changes, you find that the body is not able to cope up with all this. That's why you'll find that there's too much sugar in the bloodstream. So that's how gestational diabetes comes along. It's all attributed to the hormonal changes during pregnancy. And of course, when we have the causes, but there are risk factors that can predispose you, or you are more risky of developing type 2 diabetes if you were overweight before getting pregnant. If you are overweight, obese before getting pregnant, it is a risk factor for you that you might develop gestational diabetes in your pregnancy. Another risk factor is women who have PCOS. We know that PCOS, it makes even sometimes difficult for women to conceive. But once you conceive, again, it is a risk factor that, because when it comes to PCOS, there are issues with insulin. So you find that when you have PCOS, you are at a higher risk of developing gestational diabetes in your pregnancy. And also having a history of diabetes in your family, that is the family history. If you have that history of diabetes, also it predisposes you. And also when you have the prediabetes, this is a state where your sugars are higher than normal but not fully diagnosed with diabetes. So if you have prediabetes, if you had prediabetes, it is also a risk factor for you that you can develop gestational diabetes. And also if you had gestational diabetes in your previous pregnancies, in your next pregnancy, it becomes a risk factor for you. So those are some of the risk factors that can predispose you to developing gestational diabetes. We've talked about the PCOS, history of diabetes in the family history, being overweight or obese. All those, they can predispose you to getting gestational diabetes in your pregnancy. So to diagnose you for gestational diabetes, your doctor might do glucose tolerance test, which involves giving you some grams of glucose, then checking your blood sugar levels after a while, maybe after an hour, to check how the body has reacted to maybe too much sugar, if the body was able to control the blood sugar levels. So that's one test the doctor might perform. There are so many tests that before you are diagnosed with gestational diabetes that you undergo. That is just one type of test that the doctor might perform, and that is the glucose tolerance test. So let's talk about the nutrition therapy of gestational diabetes, or what we call how to prevent gestational diabetes. Of course, when it comes to controlling or preventing, we go back to the risk factors. And one way of preventing gestational diabetes, it is losing extra weight before getting pregnant. If you are overweight or obese, you start shedding or losing those extra pounds before getting pregnant, just to prevent, being on a safer side, to prevent yourself from getting gestational diabetes. And also staying active throughout the pregnancy. When you exercise, safe exercise as recommended by your doctor, you are able to control the blood sugar levels. So lose extra kgs and also stay active throughout the pregnancy. And also another important thing, eating healthy. You can trade the sugar cravings, that is all those candies, ice cream. You can trade the sugary snacks with natural sugars. You can take your natural yogurt. You can add in some bananas just to make it sweet, and also you can do fruits with the natural sugars, and that way you'll be able to curb the sugar cravings in pregnancy. And also another important thing, it is attending all your prenatal or your antenatal clinics, because when you attend all the clinics, this is the time that maybe your doctor might ask for gestational diabetes diagnosis or test. But once you don't attend the clinics, you just stay at home, and you're predisposing your child or your baby to health risk, and also you are endangering your life. So lose those extra kgs, stay active, eat healthy, and also attend all the antenatal clinics. And of course, when you're diagnosed with gestational diabetes, this is the question that most moms ask. Will gestational diabetes affect my baby? The baby will come healthy when you manage or you control the gestational diabetes. And actually, after delivering, the doctor will do the blood glucose test for the baby to check for the glucose levels or the sugar levels, and if they are low, the baby will be taken care of. So it you it's not all lost. You are able to give birth to a healthy baby, and also if you control the sugars, also your health is guaranteed. But when you have gestational diabetes, it is a risk factor that you might give birth to a larger baby than normal. But this is not a it is not it's not that bad. You can be able to control the sugars, because actually when you don't control the gestational diabetes, you are predisposing the child to developing type 2 diabetes later in life. And also yourself, you can develop type 2 diabetes in later in life. But when you manage the condition as recommended by your doctor, if it's diet, eat your food as directed, exercise, and also take your medication as prescribed, so that you can be able to prevent all the health risks that can come with diabetes or with gestational diabetes. So you can be able to prevent it, and also you can be able to manage the condition. If it just come, you can be able to manage the condition and have a healthy baby, and also have yourself healthy. So that's what I had for you on gestational diabetes. I hope you've learned something. So if you have learned something, let me get to know what you've learned on the comment section, and also give this video a thumbs up, a like, and also turn on the notification bell, so that anytime I upload an educative and informative video like this one, you get to be among the first people to get notified. And also, most importantly, subscribe to this channel for more of the nutrition tips, nutrition counseling, and more of nutrition education. Bye bye and God bless.